Hello, I'm Sophie Scott. Welcome to Health Watch. This week we have a special focus on mental health. The idea of virtual reality can have some negative connotations, with young people living their lives through the internet, for example, but it can also have some life-changing positive benefits. People with agoraphobia can now practice leaving their home, walking through crowded places in a 3D virtual world. They learn to overcome their fears in a safe environment before venturing out into the real world. 2 years ago, it would have been difficult for Paula Sinclair to be here at Sydney's Macquarie University. She suffered agoraphobia.
Fear of closed spaces, so lifts and going in the tunnel and things like that. And what I was doing was avoiding them, just not doing them at all costs.
But she read about a new approach using virtual reality to help patients overcome their anxiety. In real time and as if in real life, patients are very gradually exposed to different scenarios. One of the reasons it works is that the therapist can completely control the environment, unlike the real world.
So far the results are quite positive because the patients are less afraid when they are confronted with this kind of environment. They have also a better mood and a better humour, and they are less stressed overall.
Virtual reality has been used to treat phobias for a while. Despite that, researchers say it's never been done before in Australia. The techniques are easy to master, even for hapless reporters.
There is also past studies about the treatment of spider phobia, arachnophobia, and also height phobia, and also driving phobia.
For Paula Sinclair, the program has been life-changing.
I found it fantastic because you could practice repeatedly each situation, so that the situations are specific to you, and I was given coping strategies which I went over in each situation over and over again, so they become a habit.
She says the program has meant she stops avoiding stressful situations and can live a full life. Researchers now want to trial the technique on a larger group of patients. The medical profession has launched a campaign to reduce the high level of suicide amongst doctors. Depression researchers have found that medical practitioners are more likely to take their own lives than others in the community, and many doctors who suffer from depression and anxiety are not seeking help.
For general practitioner Naomi Harris, the battle against mental illness is professional and personal. She had her own debilitating experience while studying medicine 10 years ago.
I went from having quite mild depression to being in a catatonic state within a few weeks.
Dr Harris has managed her condition with the right treatment, but research suggests many doctors suffering from anxiety and depression are not seeking help. A review by Beyond Blue has found some believe that doing so would hurt their careers, and some are self-medicating with prescription drugs. The review also found there's a high rate of suicide among medical practitioners, with female doctors more than twice as likely to take their own lives as women in the general population. Beyond Blue says the profession has known about these issues for some time, but has made little progress in addressing them.
It's not much point us putting so much pressure on our doctors that we expect them to be there 24/7 if the result of that is that they become ill.
Former AMA President Mukesh Haikerwal recently sought treatment for his own mental illness and is part of a group pushing other doctors to do the same.
I see it as a professional responsibility to make sure that I am well and fit for work before I went back to work.
It's hoped further research will help identify the risk factors that trigger anxiety and depression among doctors.
And Australian researchers have found a link between a lack of sleep and mental illness in young people. They found young people who slept less than 5 hours a night were 3 times more likely to develop conditions such as depression and bipolar disorder. That's all for Health Watch. See you next week.